A very good evening and warm welcome, everyone. I, Dr. Ritika Dhiman, welcomes you all to Voice of Healthcare's yet another episode of Futuristic Friday. Futuristic Friday is Voice of Healthcare's virtual interview series where we invite leaders and visionaries from the different walks of healthcare who are bringing about disruptions and transformations in the space of healthcare technology. This series is for everyone who wants to stay updated about what's buzzing in the world of healthcare technology and what's the future looks like. Our guest for today is Mr. Jayant Roy, Managing Director, Lindstorm. Lindstorm helps healthcare organizations in delivering hygienically clean, smart workwear, linen, and patient wear, along with sustainably developing these solutions. So I welcome Mr. Jayant. It's our pleasure to have you.
Thank you, Dr. Ritika. The pleasure is mine, and I thank all the people who've tuned in today. And I hope we have interesting and enriching session.
We hope that too, Mr. Jan. So, healthcare has seen a tremendous growth in the last 10 years, but there are still gaps where we can talk about when we talk about healthcare delivery. So, how do you think is emerging technology bridging the existing need gap in the healthcare?
So, see, all of us are aware of the COVID-19 pandemic, and there are a lot of shifts that have taken place post the COVID-19 pandemic. Some examples are like the consumers are increasingly, participating in healthcare decision making. There is a lot of adoption of virtual health and other digital innovations that are coming in. Interoperable data and data analytics use is something that we are seeing, widespread these days. And everyone, whether it's the government, the healthcare providers, the other stakeholders around the globe are, quickly adapting to the different innovations that are coming in. The good thing is that consumers are now driving, or rather, I would say, they are accelerating the pace of change in healthcare. Their needs and goals are driving innovation in the health related products, services, and tools. For an example, if I was just going through some data that today virtual visits for any clinical treatment is much more than what it was pre-pandemic levels. So if I go and see the data that is available today, from it was about 15% back in 2019, which has gone up to almost 30% in the year that went by. And in the next 5 years, we expect almost 80% of people likely to have virtual visits for any clinical treatment rather than face-to-face interactions. So that's one example of how technology is being used. Another example is if we see today, all of us are monitoring our health more and more. So we see a lot of people, or rather, everyone today has a smart watch or a smart gadget that they are using to measure their fitness levels. They are monitoring their health data through that. Today, we are using our mobile phones to order prescription drugs. That's ordered online. So a lot of this behavior is now coming in where technology is being used. If I have to talk about Lindstrom, another way that we are doing it is that our garments or the workwear or the patient uniform or the linen that we provide, these are all digitally supported. So it's very easy for a customer to understand when this workwear was last washed, and that it ensures that they comply with even the most stringent hygiene regulations, because there has been a lot of evidence, especially which was studied during the pandemic, where how long can the bacteria live on fabric is something that was mapped. And with our digital solutions, this tracking makes it very easy to understand when were the garments serviced, when were the garments refilled back. So all that becomes very easy to track. So these are some examples of how today technology is playing a much bigger role in healthcare delivery.
You have rightly mentioned that consumers are driving the decisions in healthcare delivery now. They are more sensitive towards their health. And in the current scenario, patient needs and expectations are also evolving. They seek very personalized, convenient, and patient centric approach that is tailored to their unique circumstances. So, building on to that, how do you envision the future of healthcare delivery considering these advancements in technology and evolving patient needs?
See, one thing that we have to understand, earlier this term healthcare, and this was termed a few decades back. So from healthcare, I think what we are looking at moving towards is more on the health itself and well-being. Yeah, every one of us is allocating more resources like time, money, attention to the end part of the healthcare value chain, right? That is treatment and aftercare. But now the focus is somehow shifting also to the beginning, right? Beginning means there would be a lot of focus on promoting healthy lifestyles, vitality, wellness, yeah, and on primary and secondary prevention, on early diagnosis. So right now, we always used to come for with ailments or with disease. But what we are now looking at is that how can we eliminate it right at the source, and if not eliminate it, how can we diagnose it right at the early stage. Even if you look at from the payments perspective, currently the way our healthcare structure or healthcare model is designed is it's been for fee for service, where payment is made on the basis of number of services provided. So for all the number of tests that you would have undergone, or the number of appointments that you would have had. And if you look at it from the patient's perspective, this focuses only on quantity rather than quality of service. But we are seeing that a lot of this model is changing into a value based model, where payments are becoming outcome based, and people are willing to reward the service providers according to the quality of treatment that is received, and not on the number of interventions that would have taken it. The moment we start looking at this, what we need is a lot of interoperable data, and that would be only enabled from technology. And that's why we are saying that if we are looking at value based care, which would mean that continuous implementation of the care model, enhancing patient experience, standardizing the outcome and cost of care, paying, or rather outcome based payment that we are making, all this can only happen if we have a lot of data sources, and that is only possible if we start using technology. If you look at what would be the clinical implications of this, it would mean that prevention of illness and early detection of disease, like I was mentioning, that right at the source itself, accurate diagnosis and appropriate treatment to be given to the patient at the right time, fewer complications that we are talking about, faster and complete recovery from illness, and then again, no recurrences, or very, very fewer recurrences of the illness. So that is how I see that, the shift from, just a very, very transactional healthcare delivery to a value based healthcare delivery will happen.
Excellent point made here that now people are talking about value based care. They talk about quality and not quantity. And there are very numerous challenges, including the population growth, aging, demographics, raising healthcare cost in global pandemic like the COVID was one. So it is imperative to explore how technology can be harnessed to create a healthcare ecosystem that not only address the immediate healthcare need but also ensure long-term sustainability and resilience as well. apart from the quantity itself. So, how, in your opinion, we can use tech-based solutions in building such sustainable and resilient healthcare ecosystem?
Yeah, see, I think today what the one of the biggest challenges in terms of the resilience of healthcare ecosystem that world over is being felt, not so much in India. One is the aging population globally. In India, we are still a very young country, I would say, but the world is witnessing an aging population. And the other is the high employee turnover, especially in the healthcare ecosystem, right? Which would mean actually more patients and less employees, and that keeps getting magnified. Now what happens is, if your employees are responsible for your patient experience, how do you make sure that your employees are extremely or having a good experience themselves? Now if you look at Lindstrom, and I will use that as an example because we've seen it, when Lindstrom is designing garments for you or for your employees, which are quality products, very comfortable to use, breathable. This leaves a great experience for your employees. And the moment the employees have a good experience, they pass on this experience to the patients. So in a way, we have to start looking at such SOPs for the employees, so that the employee gets a great experience and that same experience can be passed on to the patients. So that is in a way how we can look at healthcare becoming I would say more robust in terms of delivery in the future. Then comes the sustainability part of it. So if you see the figures that have come out, with everyone talking about the Paris Agreement, and there the numbers that it showed was that healthcare's climate footprint today is equivalent to about 4.4% of global net emissions that are there. And healthcare must respond to this challenge or the emergency uh, by reducing its own emissions. Now, so healthcare climate actions also align with the Paris Agreement, wherein we are looking at healthcare facilities, sectors, goods and services that they are used. How can they achieve that net zero by 2050 or even before? Similarly, if you look at a service provider to the healthcare industry, uh, when I talk about Lindstrom, we are looking at today designing products which can be used to last longer. We are using recycled fibers to manufacture these products. There are various ways that we are looking at reducing overproduction, like in terms of our garment design. They are designed for long life with durable materials. We have our own production on demand facilities, so we don't have to start maintaining huge stocks. We try and repair all the garments and keep using the garments to the end of their life, and not discarding garments just because they probably would have developed some minor wear or tear. The same set of garments, so today if there's a high employee turnover, the same set of garments are reused for the other employees, right? And since all our garments are RFID tagged, we keep optimized inventory, since there is a lot of data points that we also get from our garments that tell us that, okay, what is the kind of stocks that we need to maintain, and we do not overproduce. So these are some ways, like we are doing it for the hospitals. Similarly, there would be other service providers which are already working in their fields, and all of us have to come together to help healthcare reduce their carbon footprint.
Yes, you have mentioned regarding the carbon footprint, and we are seeing that climatic and global changes in the environment, in the climate. Today's storm, next day it's very hot to up to 40 degrees Celsius, and I think technology and sustainability can go in hand, just like your organization is also doing. Just you told just now. And what apart from technology, so what do you think are the key factors that impact the sustainable development in healthcare delivery?
See, there are quite a few, but since I come from the specific of hygiene and the handling of the uniforms and the linen part of it. I will speak a little bit about that more in, because that itself can show you the quantum of impact that it can have. One thing we have to be very clear that, like you were mentioning, that sustainability and the delivery needs to go hand in hand. So it cannot be isolated, because the quality of the service provided by the healthcare facilities need to be affordable, right? People need to have, more and more people need to have accessibility to it, but there also needs to be a sustainability measure that needs to be attached to it. For example, I'll give you in a lot of healthcare establishments, we see that home washing of uniforms takes place. So the nursing uniforms are usually taken back home and washed. Now this starts affecting the healthcare delivery, and purely because there is a risk attached to this. Risk of transmission from one patient to the other is extremely high. We all, like I was mentioning, that there was a lot of studies done post or during the pandemic also, that the garment can be a component in the chain of infection transmission, because the bacteria or viruses can live on different kinds of surfaces, right? And that is where the home washing makes it even more dangerous. Whereas if you've got industrial washing facilities, like we have it at Lindstrom, these are designed to segregate different soiled garments based on different areas of application. Here, the washing is recommended at a temperature of 71 or 72 degrees, because that is the temperature that is required to kill the bacteria, right? So these kind of, when adoption of these kind of services comes in, it definitely brings a positive reaction to the healthcare delivery. Now, when we talk about sustainability, like I have been talking, we provide a renting solution, so rental textile solution, right? Now, that is a sustainable choice, because it is not only user friendly but also eco friendly. Yeah, when you tie up with any, so I'm not only talking about Linstrom, there are worldwide a lot of rental textile service providers. What you do is you reduce your environment impact, because you are then using or opting for textiles that are using optimized raw material. Manufacturing and transportation is optimized, maintenance and tailoring on of these textiles is minimized, and there is a digitally supported service provider who then maintains and optimized stock levels for you. So these are some ways that we need to look at more sustainable options that can come in here. These are some things, like I was mentioning, that since I come from that background, I was talking more. But one of the biggest challenges that we also see is the management of waste disposal and air pollution, medical waste, that has become one of the top polluting sources worldwide, right? So I think that is again one of the imperatives for the healthcare organizations, to have a multidisciplinary team which are addressing all these different aspects of sustainability in healthcare.
Yeah, so one thing you have mentioned about the linen, and you have rightly mentioned that the bacteria that harbor, so the linen harbors the bacteria, and we need to be very, what do you say is, we need to be very cautious about how we are washing the linen, and the sustainability, the rental service that you have talked about. And this is turning out to be a very interesting conversation, because we have one question from the audience itself, that at service provider level hospital, we find that more and more hospitals are going for disposable surgical gowns and linen. So what is your take on this? So this is one question that we've come up with. So if you could
Yeah,
answer that as well.
absolutely. And I think that is something that is happening purely and purely because they do not have access to such service providers which can maintain the same levels of hygiene and continue to use reusable, garments or linen. Because of a lack of such a network, hospitals then, when they want to maintain those hygiene levels, opt for disposable products. But at the end, what is that doing is just adding to the environmental burden. Interestingly, why I can talk very closely about this topic is when we are present in India for the last 15 years, and we've been providing workwear to the manufacturing industry, food, pharma, other manufacturing industries for a very long time, right? We used to provide the workwear for hospitals as well. But the biggest challenge in hospitals, apart from workwear, was the linen. And it was the hospitals that started discussing with us that how we could bring in the linen management, which was there present in our other world subsidiaries, but was not introduced in India, because in India, a lot of people still believe in those transactional, vendor management relationships, where they don't care that where is the linen getting washed, what machines, what temperatures, what detergents are being used, which till now was being accepted because people were not so informed. Now with consumers becoming informed, or patients and the entire generation becoming so informed, people have started demanding higher levels of hygiene, and there are not enough service providers to provide it. So the easy way out is going and getting disposables, but that's not the sustainable route.
Rightly. So we have come back to the value-based care and the customer sensitization nowadays that is happening. So with this, I would like to end this conversation here because we had a very interesting conversation about apart from the healthcare delivery that we are providing to the patients, we also have to be very conscious about the environment that we are in, because we are seeing such changes, such drastic changes. So sustainability is one thought that we need to take care of as well. Uh, thank you so much. It has been very engaging and interactive conversation and interesting conversation with you. And I'm sure our audience has learned so much from your uh, thoughts. And I wish you all the very best for what you are doing. And yeah, thank you so much. I would like to
Thank
thank the
you.
audience as well.
Yeah, thank you, Dr. Ritika, and thank you for all the people who've joined in. And of course, one thing that I would want to appreciate is that through this channel, I'm sure you are reaching out to a lot of people who are or would be today the decision makers, or would be the influencers. And I hope that this really spreads the word around healthcare delivery and more sustainable options for us. Thank you once again.
Sure. Thank you so much, all the viewers as well who have stayed with us for this session on Futuristic Friday.